In this presentation, I would like to share with you some videos that are published in the Thai language that teaches how to make DIY hand mittens, the cowl or the hand restraint to be used primarily to prevent to be worn by the elderly to prevent them from pulling out IV tubes, their oxygen tube or their nose tube. In Thailand, normally we do not apply very like sometimes you see in videos, right? They put like the restraint whereby they literally immobilize the patient to the bed with those vests and all this heavy stuff. In Thailand, normally they would just limit to a hand restraint and then they would just tie them to the bed. So when my mother was hospitalized, they also have these restraints because when they put in the nose tube for her, my mom had Alzheimer. They know that she has a tendency to pull out, so they have all this ready. And if you are in another country, you may face a challenge of thinking how to restrain the elderly. Sometimes they may not even have dementia, but some people are very resistant to hospital visits. Sometimes they may insist to go back, and then when we refuse to discharge them, right, they will just take their hand and try to pull out the IV drip or their oxygen tube. Or if they're on nose feeding, they try to pull out the nasogastric tube or the PEG tube. So having these restraints are very helpful, and there is one of the channel which I feature here, called Chompu Handicraft. Basically what she did is that she made a video to show how to make these DIY hand mittens, and after that the hospitals actually feedback to her that it was very, very helpful, and then she made another more thorough video to show how to make a better hand mitten. I will include this in a later part of this presentation. But first, let us go over how to make the ingredients required to make these DIY hand mittens. First thing first, you will need a plastic bottle, but this bottle cannot be from, it is usually what they do in Thailand is that they take it from the NSS bottle. NSS means those normal saline solution. Normally is provided by hospitals. You can see in the hospital where they actually administer to the patient via IV drips. And there's a lot of these bottles that can be found in the hospital. I don't know about how the other pharmacy, whether the pharmacy sells it or not, but the unique thing about some of these bottles is that they are pliable. Means that the bottle, we cannot use like mineral water bottle or like the soft drink bottle, those kind of plastic bottle, because this, what they will do is that if you use that kind of plastic, the normal plastic bottle, they have a tendency to try to knock the hand restraint against railings and against hard surfaces. So if it's a normal plastic bottle and you start knocking it, right, it will break. But this NSS saline water bottle, right, called the natural saline solution, which is provided in hospital, this kind of bottle comes, some of them come in that kind of pliable, like kind of squeeze water bottle kind of material, whereby if you keep banging it, also it wouldn't break. It will take a long time before it can break. It's a very pliable material. It can bend and it's soft. At the same time, it is durable enough to withstand hitting against hard surfaces. And it's thin, so it's not too hot. If you can't find this bottle, maybe you can try to look for something which is of a kind of like squeeze bottle kind of material. Means the plastic must be able to bend easily, is thin enough, and at the same time it would not you know that when you try to hit it against hard surfaces like bed railings and all this, it will not break easily. The next thing we will need is, depending on what is the material you would like to sew, because there is at the bottom, what they'll do is that cut it, and then you need to have kind of like a material to cover the edge of the bottle and the wrist, to tie at the place where you tie the wrist. So you can choose either using cloth, or you can crochet or knit something over the bottle, as shown in this picture. The third unit is a string, a kind of not the raffia string or those very soft string, the one that usually people use to have to tie bags, to tie the bags. You can see in the picture, this is it should be thick. It does not, and it should not be too thin that it will break easily, or it will cut through the wrist. It's thick enough because you will have to tie it most of the time tightly, snugly. So when you tie it snugly, you use the kind of cotton thick thread, right, that will not cut into the person's skin, or it's not heaty. So this is the kind of string as shown in the picture here. And then you also need a scissors and a puncher to punch the hole at the plastic. Now there are a few methods of making these hand mittens, and the basic principle is the same. Means you take the NSS bottle, right, and then you cut at the bottom part, as shown in the picture. You cut it, and you start punching holes at the edge, as well as in the middle, throughout the bottle, because that is to let air and circulation go through, because the hand is going to be put inside. So the punching of the hole can be done by either, because the plastic is pliable, you can bend it while you use your puncher to punch the hole. Or some people, what they do is that they have this carving tool. When you carve, you have this hammer and the kind of like blunt nail. So they will hit on the plastic, and then they'll form the opening. So if you're using the kind of carving tool like a hammer or blunt nail to hit on it, right, please, it's a good idea to put a sponge in between to prevent it from breaking the bottle or something. So you can use that, or I have seen in the video A by Rama Square, what they do is that they just bend the bottle and then they just punch the hole on it. Then depending on what is the material you want to use for the wrist covering, I will include the reference to the videos of how of those that use the cloth in video A of Rama Square, and then video B and C from Ning Sri Crochet and Chompu Handicraft, where they crochet the on the bottle itself and make it into a kind of like a handle. But first, let's talk about the cloth one, because the cloth one I need to explain a little bit, because since the video is in Thai, you may not be able to understand completely. The nurse student, actually, she's the one that did the demonstration, is a nursing student. So what she said is that the cloth, right, you use it in the middle, you have to sew, you have to already sew. You can see in the picture, you sew in the middle part. That is for you to put in the string, because you need to put in the string in order to tie the wrist. Then at the top part, what you do is you stitch, because you already punched the hole at the water bottle, right? Then you just stitch on the cloth. You stitch and attach it to the plastic NS bottle. So the top part, she said, covered with the tape. That's how it's being done. Then later you can see in the video video A, which I referenced below, how they actually make the whole DIY hand restraint for the DIY hand mitten from start to finish. Okay, next come the crochet, the one on the crocheting, how they crochet the thread over the cotton thread. It's advised to use either the thick cotton thread or the baby soft type. One of the videos mentioned to use the baby soft wool or thread materials, so that when it covers the hand, it feels more comfortable. So you can see that this video is in video B and C. You can see how it, if you have the foundation and you know how to do crocheting or knitting, then you will be able to get what they are trying to say. I'm sorry, because I'm not good at crocheting, so I will just include the video. When you hopefully when you see, right, you will get the idea how they do, because they actually do a close-up and it's very clear how they crochet on the bottle itself. So this is please refer to the videos in the description box. It's explained in Thai, but and honestly it's quite hard to find all these videos, so I hope that it will be helpful for you. Now the third type is what I bought from the pharmacy in the hospital where my mother was in. They sell me the mittens for 195 baht, which I think is probably maybe USD $4 or $5. So you can see that from the picture of the mitten here, it is actually same. They use the NSS saline solution bottle, the recycled ones, and then they stitch a cloth, but this cloth have the padding. Means if you look at the cloth, it's actually quite thick. It's thicker because they have a kind of like a sponge padding on it, the kind of padding that you will find in an owl mitten. You know, the similar with when you use an owl mitten, you feel that there's a padding beneath, right? So they did at the wrist area, as well as you can see that there's another cloth padding structure on the top, like how you see in the top of the owl mitten where you put the 4 fingers in, right? So this one, I think is a better one, because this one, since they are selling it commercially, so I mean they're selling it like a DIY thing, so that's why the quality is they make more effort in also making the top. Now to use this hand mitten, you have to tie it very snugly at the wrist. The wrist is the smallest area, the thinnest area of the hand. You have to tie snugly so that it prevents the hand mitten from sliding down. When you tie it, this is the mitten my mother used during the week when she was hospitalized. The hospital actually just provided it and then told us where to buy the mitten when we need it. So the hospital have all this, the ward actually have all these things ready for special patients that may pull out the tube. Now this mitten, when you tie, you wear it snugly at the wrist. You can see that the length, right, at the position, your hand won't be able to reach the top part of the cloth, the area, the upper part with the cloth, because once if you don't tie it tightly and the hand reaches the upper part of the cloth, right, what is going to happen is that they are going to be able to bend the hand, and then from there, when they bend the hand, they will pull out the tube. A bit of background noise you hear is actually my mother using her leg to hit on the railing of the bed. They always will hit on the railing, don't know why. So that's why when you have this kind of, with the mittens, if the top of it, right, there's padding, sometimes when they hit, it's less painful. But the downside of this DIY mittens is because the hand is covered on the plastic area, it can really get very hot. It can really get hot. So that's why it is advisable that you don't wear this mitten you don't let them wear the mitten the whole day, because you imagine that your hand is actually resting on a plastic, and even though there is a punch holes, right, it's still plastic. So if it's not washed frequently enough, to have this mitten, you will need two pairs, to actually at least two pairs, because when you change them and wash them, while one dry, then you need to have another. But they shouldn't be on this mitten all the time, because it may cause the skin, if they sweat a lot and then the sweat condenses, it may cause rashes or allergies. Therefore, if you're able to monitor them, then the hand should be restrained, should be maybe alternate between this one and then is being restrained at the big post. That is still better than tying them in a kind of bodysuit and not letting them move. So you can have, if you have this mitten, right, at least they are able to move around. It's just to tie up the hand, but they can still move their hand and they move their body around. Lastly, what I want to show you is the DIY hand restraint that's being made by the hospital themselves. So this one, I couldn't buy it anywhere because the hospital told me they make it themselves. So this one, they actually use recycled cloth, like the hospital gown, doctor's gown, the bed sheets, the serving cloth. So they just sew it and then they make it into a hand restraint. It is actually quite comfortable, because you see the white color, the main one to wrap up the hand, right? The padding is they actually have a padding. I think they use multiple cloth to make it thicker, so the patient actually will not feel uncomfortable when using it. But for my mother at the moment, she's using a hand mitten that is made by Mesa Medical. It's a Thai entrepreneur company. So we bought the mitten from one of the main pharmacies in Bangkok. So that mitten, right, actually it can be worn long term, because the covering inside is made of cloth, and then there's a netting. So the mitten is on my mother's hand the whole day. I only take it out once a day when I need to wash her hands, when I do the washing on the hands when I'm bathing her. And the company also make the hand restraint as well, which is also padded. So we also bought it from there to use it. But the hand restraint, the one that tie to bed post, that one I don't use it anymore, because nowadays my mother is very used to the mitten, and I don't have to tie her hands. I put the mitten from this company one over her hands, and I actually will change and take it to wash every 4 or 5 days. But I no longer need to tie or restrain her, even when I'm doing phlegm suction or when I'm changing the tape at her nose, because her nose tube require a plaster to be secure. So I do not need to tie her up already. She's like used to it. And I also learned to do it more gently, because you keep doing it every day. After a while, you get used to it. Find a way not to hurt the person. Be careful, so they would be okay. So the only instant probably that I will need to have a hand secure to the bedpost would be when it comes to changing her nasogastric tube, which have to be done once a month. So I hope that this video is helpful. The videos in Thai, the crocheting part, you can see just from how they do it. If you know how to do crocheting or knitting, right, I believe that you will be able to understand how they do the knitting, and I really hope that this is very helpful, because I don't find this anywhere else available in any part of the world. And these are something that, because in Thailand, people take care of their elders in their home, so they are not being placed in aged care facility. In the home, the environment is more familiar and they are cared for by family members. So therefore, usually they are less aggressive, and we hardly hear that that the elderly is being restrained a lot. It's just they just need to tie. They just need to restrain the hand to prevent them from pulling, because sometimes it's like, even for normal people, you know, when they are on the tube, when the tube feels very uncomfortable, even when they are asleep, unconsciously their hand might reach out to pull the tube. So some people even wear the restraints, and hospitals have feedback that these restraints are very helpful. So you can see that in some of the video reference that I give below, right? There's one video which is actually demonstrated by also nurses from another hospital on how to crochet this for the hand mitten, the DIY hand mitten, because hospitals also have this and they store it for their patients as well. Normally they don't use heavy duty restraints on the patient unless absolutely necessary. Otherwise, normally you will see, like in some beds, there's just this DIY hand restraint made of cloth, or the hand covers. The hand covers normally are for Alzheimer patients, because they will try their best to pull out the tube. But most of the time, if can also, they don't actually restrain their elderly as well. So hopefully in other parts of the world, you'll be able to get this material, and you'll be able to make the DIY hand mitten when it's needed to. Thank you.